89-year-old Mary is in a nursing home and was due to have her second dose of the vaccine next week, but now that's up in the air.
If she had had both vaccines, then we would be able to think, yeah, OK, Mum, we can get on with looking after you in the way you ought to be looked after.
UK health authorities have backtracked on their original plan to give 2 doses 3 weeks apart. People will now have to wait 12 weeks.
Let's vaccinate as many people as possible, because at the moment lockdown on its own, I'm sure it's helping, but on its own it's not controlling the infection.
Authorities say the first dose provides most of the initial protection, but Pfizer hasn't tested the effectiveness of its vaccine under the new plan. Doctors say they're now having to cancel appointments.
Actually having to have a conversation with over 1,000 patients about the fact that the arrangement you've made no longer applies, and no, you don't know what's going to happen next.
Hospitals here are struggling to keep up with the rapid increase in cases, exacerbated by the new variant of the coronavirus that has a faster rate of transmission.
Deciding, the outcome of effectively a competition for a ventilator is not what anyone signed up for. It's horrifying. We shouldn't be having to do it, but we are.
The new strain is spreading across the country, with a new study from Imperial College London confirming it's much more transmissible.
Under the lockdown, maybe over the course of 2 to 3 weeks, the cases would have decreased by something like 30%. All of a sudden, instead of a decrease of 30%, we get a massive increase. The number of cases over the same period could triple. So this is more or less the most serious change in the virus that we've seen.
But there's more help around the corner. The recently approved Oxford vaccine will be rolled out next week. While it's easier to store, only 500,000 doses will be available on day one, far fewer than the country needs as it struggles through a long, dark winter. Nick Dole, ABC News, London.